Who are some women of different ages that I consider beautiful? Definitely Catherine Deneuve, French actress. Her beauty is like timeless. She definitely had plastic surgery, but she looks amazing. Trace Lizette, who's a trans woman, and she's absolutely stunningly beautiful and young. And I would say Michelle Obama. She is strong and powerful and natural looking, and I think she represents a real natural beauty. Who are some men of different ages that I find attractive? This is so standard and obvious, but I gotta say George Clooney. I love his voice. Like, his voice is just amazing. He was the voice of Fantastic Mr. Fox, so how can you not love that? I love Liam Neeson, and his accent is to die for. And Shamar Moore, who is young and just beautiful and can do no wrong. I think there's a whole industry of beauty myths out there, and they have to do with products and sort of the infomercial world and influencers who tell you you must buy X, Y, or Z. And I think even plastic surgery procedures. So there is no silver bullet out there. There's no one product that's gonna reverse your aging or fix your skin problems. There are probably a lot of products. And I think the way I approach all procedures and products is with some scientific inquiry and really look into, is there any evidence that this product, this procedure actually works? And if there is, then I would put that in the category of something that you should consider using. But many, many products and procedures are in the category of there's no evidence that they actually work. So you shouldn't just take somebody's word for it because they happen to be beautiful and they happen to be on TV recommending some treatment. Definitely, definitely, yes. I think plastic surgery used to be a very female-dominated patient population, and now it's really expanded. Age has also expanded, so I find men are very interested in staving off the aging process, and as long as it looks natural, they're not scared of having plastic surgery. What procedures have advanced the most in recent years? Liposuction and fat grafting are really evolving continually, and they, in majority of cases, are very safe and effective, and you literally can move fat from a place in the body where you don't want it and put it to a place in the body where you do want it. So it's sort of a total win-win, and now the techniques have evolved so that it's very reliable. That's changed dramatically. The other thing that's changed a lot is breast reconstruction for cancer or any breast deformity. There are so many different options for breast reconstruction nowadays, and then non-invasive surgical techniques have evolved for facial rejuvenation tremendously. Any tips on aging gracefully? Definitely. I think that the two aspects of aging, or three really, that are the most important are taking care of your skin, taking care of your diet, and being active. And if you do those three things, you will look much, much younger than people your age who are not taking care of those aspects of their life. How has my perspective on beauty and wellness changed over the years? I think when I was younger, I didn't really think about anti-aging or wellness. And part of it was when you're young, you just don't think about those things. But the other aspect was I was just working so hard, I didn't have the breathing room to think about anything other than work. And when I finally came up for air and had some time to think about it, I thought about all aspects of life and enjoying life, because I'd just been working so hard for so long. So I really took some time to think about what it is to have a good life, and what wellness really means, and what beauty really means. And so it really went from not thinking about it at all to thinking about it a lot. What message would I like to give young people, including transgender and non-binary youth, about wellness and beauty? I guess the first thing, and this is something I think about a lot now, is I wish I had been bolder in my youth, and I wish I had embraced my individuality. And I think many youth are very timid to do so, and they're timid to express themselves, and they don't want to be different. And I think that often leads to feeling very constrained and confined. And I think as long as you're in a safe environment where you can express your individuality, do so. And then the other aspects are just very basic things, like move your body, drink enough water, and eat healthily. And I'll talk a little bit about what that means later. But having a healthy diet, being hydrated, and moving your body are going to make everybody feel better. I'm not exactly sure what that means, but do you feel better by taking care of the outside? I think you do. I think that if you do take some care and put some attention into your appearance, I think it affects everything. And you maybe stand a little taller, you present yourself with more confidence. Certainly if you have less anxiety, that's going to affect your organs, literally every single one of them. So yes, I do think it makes a big difference. Would I have any of the procedures done to myself that I perform on others? And if so, which ones? Definitely. Yes. And which ones? I would, if I felt I needed liposuction, I would do it. I would definitely have breast reconstruction. I will probably have a facelift. It's just a question of who's going to do it. I would definitely have my eyelids done. Gosh, there are a lot of things I would do. And then all the non-invasive stuff I'm a huge fan of. It's just a matter of downtime. So I would love to have my face lasered. I think it's the greatest thing for your skin that you can do. And I think anyone over the age of 35 should have their face lasered. But it's hard because you need to take about 5 days downtime. I would do fat transfer. So most things I would do.
Maybe I should have asked which one.
Which I wouldn't do. Yeah, right. Would I not do? Not much. I think my aesthetic is very natural and very minimal. So if somebody wants something very extreme, which many people do, or not many, but some people want to look cat-like or want big enhancements of different body parts, their breasts, their cheeks, their buttocks. I'm not the plastic surgeon for them. And there are plastic surgeons who will deliver those results, but it's not going to be me. I have an aesthetic. I wouldn't say that it's correct, but it relies on enhancement of the patient's natural features rather than making them look like a different person. So, but there are plastic surgeons who will offer that. It's just not what I do. How do you avoid the typical plastic surgery look? I think it's very easy to avoid that look, and it's basically you can't overdo things. You always want to do enough so that there's a difference, but if you overdo it, it doesn't. There's this theory that things will settle down. They won't settle down. You'll just look operated on. And then there's certain areas of the body where you have to be very, very careful. The lower eyelid is one of them. and it's a dead giveaway for people who have been overdone, and it has sort of a unnatural look that your average person looking at the person who had lower eyelid surgery that wasn't done well would know something is different and something doesn't look right, but they wouldn't know what it was. So I think you have to be careful to enhance but not overdo, and to be very careful of certain parts. And the lower eyelid is one, the jawline is one, the lips. You never want to enhance the lips too much because it looks cartoon-like. The answer is yes, depending on the quality of the person's skin. And as we age, our skin thins out. And if the skin is so thin that it's not going to kind of hold the results, then it's probably pointless to do plastic surgery that involves moving the skin. It's real, and it is incredibly powerful. And if you think about all of the quote-unquote stars, and even on Instagram, people who are influencers, they tend to be very beautiful people. I think it is human nature, but we need to be careful about it because we do ascribe qualities to people who are beautiful that they may or may not possess. We tend to think that they're kind, we tend to think that they're smart, that they're good, and all of those qualities we give them, and they may not actually have those qualities. I think it's not easy to be unattractive in this world that we live in, and I think that is unfortunate. Do I feel that my patients are a lot happier after getting cosmetic surgery to enhance their looks? I wouldn't put it exactly that way, but what I would say is if I am careful about my selection of patients, which I generally am, they feel more like themselves. They feel less unhappy. And they look in the mirror and they see what they were expecting to see. I think one of the things with aging that is shocking to people is you have a feeling of youth inside your body, and you look in the mirror and you don't see that, and it's upsetting. It doesn't affect your overall happiness per se, but I think you feel a lot better when what you think of yourself is aligned with what you see in the mirror, and you feel more complete, maybe, and more whole. Not necessarily happier, but just more like yourself. Is it my opinion that people want to change their looks to get more approval from others, or they just want to feel better in their own skin? I think both. I think people definitely want approval, especially young people who are really connected to social media and quote unquote likes. And I think it's actually a problem because I think that there's always going to be someone who has more likes than you, and there's going to be someone who's perceived as more attractive. So I think ideally we should be trying to make ourselves feel better and just internally, but that's not a reality. That's nobody's reality unless you live in a bubble. So I think it's a little bit of both, but I am very careful, especially if it's related to a particular relationship. So if there's a partnership and one of the partners wants the other partner to do something, a facelift, a breast augmentation, whatever it is, I'm very careful and cautious unless the person who's having the procedure really wants it for their own well-being. Why is it so hard, especially in our times, to accept the aging process? This is a complicated question, and I think it really has to do with our societal values, and that we do not value old people. many societies do, and they value wisdom and they revere old people and old things. And we just don't. We value youth and beauty. And so I think it's very hard to embrace old age because nobody really wants it. I do think there are ways that the world is changing. You do see more older models. You do see people who are employed at older ages. And I think all of those things are great that they're happening. But basically our society is just shoving youth down our throats and isn't really honoring wisdom that comes with old age. Isn't it almost a competition who can beat the aging process the most? And these people get written up in the media. How do I feel about that? I actually think it's great. I think it's awesome that somebody like Jane Fonda is vital and vibrant and writing books and active. And she's, I don't even know how old she is. Judi Dench. There are a lot, there are a number of people I can think of the top of my head who are still active and vital. And I think they're inspirational to us. And I think that it's an example of how we do embrace the aging process, even though they're fighting it. But rightly so. You don't want to embrace getting old and becoming feeble and becoming inactive and not caring about your looks or your beauty. So I think it's natural that we would revere and respect people who, while they're aging, they're also trying to maintain really healthy habits and an inner glow.